This is the Wizard News. Starting in April 2023, after a 3-year COVID-19 pandemic-related hiatus, patients will need to reapply for Medicaid over the next year. Across the country, agencies are restarting a practice as old as the Medicaid program itself, 58 years and counting, requiring people to prove that they do not make too much money to qualify for America's only version of comprehensive free health care. There are more than a dozen permutations of the Medicaid program, not counting the ones available to people with disabilities and those over age 65. To figure out whether you or members of your family qualify for one of them is complicated. Completing the Reenrollment form is akin to doing your taxes. For every household member, you need to fill out immigration status, age, and social security number, a list of every job they hold that brings income, and for each of those, an employer contact number and the income it provides before taxes. Not responding leads to being automatically disenrolled. You may be asked to provide pay stubs or tax forms. Maybe you got divorced, or there is a new pregnancy, or a spouse is about to turn 65 and become eligible for the other major federal health insurance program, Medicare. Do you have student loans? You can deduct that from your income to qualify. Do you own property? That normally does not count unless you rent it out, but it does matter if you need long-term care. If you have children and make a little bit too much, you might be ineligible for adult Medicaid for a few months. But if you keep track of your health care costs and show receipts, you can subtract that from your income and rejoin if that spending brings it far enough back down. When state governments were rolling out insurance marketplaces created by the 2010 Affordable Care Act, also known as Obamacare, there were plentiful grants to fund insurance navigators or assisters. Now, hospitals and healthcare clinics have to fund the positions themselves, and there are fewer around. Congress wanted to keep everyone insured during a time of uncertainty. State governments were offered a significant bump in cost sharing if they maintained continuous health coverage for everyone enrolled at that time through the end of the public health emergency. For 3 years, there were no more forms. You could voluntarily leave for employer-sponsored insurance, but you did not have to. You would not be kicked out of a program for turning 19 or 65 or for getting a small raise. As many as 15 million people may lose Medicaid coverage during the re-enrollment process, around 17% of the total enrolled. The U.S. Department of Health and Human Services estimates based on historic patterns. Almost 7 million are likely still eligible but will be dropped nonetheless, mostly for not providing the necessary information. As many as 65% of those who leave the program are likely to experience a period of time when they are uninsured. People who are still eligible but who are regularly lost to the system due to a change in address or missed deadline are one group who Medicaid administrators call churn. It occurs when someone leaves the program but re-enrolls within a few months, usually when health care is needed. A disruption in coverage can mean people stop therapy for several months or more. Source: Vermont Digger, April 14th, 2023.